Welcome to Insight, everyone. I'm Nnamdi Odipo. Health systems around the world, of course, including that of Nigeria, are still being challenged by increasing demand for care of people with COVID-19. The challenge is exacerbated by the demand to also maintain routine health services. Experts have agreed that in order to reduce the burden, then all hands must be on deck to flatten the curve of infections in Nigeria. Surprisingly, in spite of the guidelines issued by the authorities, we have continued to see an alarming increase in infections in the country, where we will be speaking with a public health expert to gain some insight into the matter. I'm particularly excited because I have two families joining me from two far-flung states. Of course, they will be part of the conversation as well. They will speak to the issue or some issues surrounding public health, safety, and also tell us how they've been handling the pandemic. My colleague Elizabeth Omorui is here at the moment. She will bring us the media review segments, of course, much later in the program. Elizabeth?
Well, it's nice to be here, and I'm happy that this week's edition is a little bit gender sensitive. You know, the world has taken a new order and a new twist, and everybody trying to be a strong player. Now, women, when we talk about development, they are also strong players. So our focus will be on the role of women in nation building with the new order.
Very well. Let's get started with the discussion. I have two families on standby. The Oyalowos are in Mushin, Lagos, and they join me via telephone. And our other family, the Ayigbes, are based in Port Harcourt, the River State capital. Let me welcome all of you to Insight. Let me get a sense of how your families have been affected and impacted by the pandemic. I'll begin with you, the Ayigbes in Port Harcourt, seeing that it has been months since Nigeria got hit by the pandemic, and we've experienced various phases of mitigative measures. Tell me, Mr. Ayigbe, how is your family keeping safe?
Okay, Mr. Nnamdi, thank you very much for the question. And it's really not been easy, you know, since this pandemic issue started. You know, the children are back, and you know, with what is going on in the country, the cost of things have really gone on. But we will try to make sure that we keep safe as much as possible. First of all, you know, with the kind of occupation I do, I'm a food technician. And in our duty and responsibilities, washing of hand has actually been something we've been practicing over time. So, and I'll be able to, you know, inculcate that in my family, my wife, my children, washing of hands before now. And, you know, coincidentally, is a major mitigating factor to what we have. So we'll be washing our hands, using our face masks, keeping social distance when they go out and come back, to make sure that they contaminate themselves before coming in. And we'll make sure that we're having zero visitors. As a family, you know, we set up a station just before you enter into our house, our own flat, where you must wash your hands before coming in. And at every point in time, we try as much as possible to make sure that we follow these rules religiously, because COVID-19 does not have a face. It doesn't discriminate on anybody, and that is what I've, you know, make sure that my family understand. And we've been doing it very well, and to the glory of God, we've all been safe till date. We've not had any issue as related to that. Thank you.
Thank you, Mr. Ayigbe. I'll go over to the Oyalowos now in Lagos. I understand we actually have them now. You are, Mr. Oyalowo, you and your family, you live in the epicenter of the outbreak in Nigeria. How careful have you been, especially with the children? I see three of them with you there. If I'm seeing you, yes, I think I can see you now. I see three of them with you there. Give me a sense of some of the safety precautions that you have taken so far in your home. Mr. Oyalowo, can you hear me?
First of all, I would like to welcome your crew to our home. I would like to appreciate the privileges you are giving us to share our experiences as far as this COVID-19 period is concerned. To start with, having listened to a lot of public enlightenment from the side of the government about this about COVID-19, coupled with the fact that by virtue of our training, I'm a science graduate, likewise my wife. So we know we are quite well informed about what it takes to keep to the measures. And we really try our best to make sure that the children are well informed and they keep with these measures. First and foremost, the stay-at-home policy of the government we are strictly adhered to, because the children were not allowed to even leave the rooms. And as for me, who happen to be the head of the family here, I'm an essential worker. I do go out, but I make sure that whenever I'm going out, I keep to the necessary measures, like avoiding keeping to social distance, avoiding contact with people, and I'm keeping to my personal hygiene, like using my hand sanitizers, washing my hands regularly, which I believe my wife is really following up strictly too with the children. We ensure that all the surfaces, having known that there is no other, the major way of getting contacted with the disease is by having contact with droplets from the people that are positive to this disease. So we ensure that we sanitize every nook and cranny of the house, and we ensure that the children keep up with their personal hygiene by washing their hands every now and then, using their hand sanitizer whenever it's necessary.
Please, I would like to speak to Abuja now, Mrs. Oyalowo, also in Lagos. I mean, there, since I already have you there. Madam, how strict are you with the issue of personal hygiene with the kids, especially during this period? Mr. Oyalowo, can you give the phone to your wife? I just asked her a question. I would like to know how strict she has been this period with the issue of personal hygiene, especially with the kids. I'll repeat the question again, Mrs. Oyalowo. I would like to know how strict you have been with the issue of personal hygiene.
That this virus is transmitted by having direct contact with the respiratory droplets of those that are positive, and also by touching surfaces that are contaminated by this virus. And make sure that all surfaces, especially the table chairs, the door handles, the remotes, and especially the toys, are disinfected regularly. And I also make sure that the kids are washing their hands with soap and water, especially after using the restroom. I make sure I do the washing for them myself. Then I also ring it to them like a bell that they should not by any means touch their face. I mean the eyes, the nose, and the mouth with their hands. So, and above all, I make sure they don't go out of the room, not even to the mosque that is within the compound. We pray indoor, and I make sure they stay indoor all throughout the day.
This is Oyalowo. I would like to cross over now to Port Harcourt and speak with Mrs. Ayigbe. Now, if you can hear me, Mrs. Ayigbe, I would like for you to respond to a question that I have for you. I understand that you are a trader. You are a trader. I do not know if it's petty trading, but you're somewhat of a trader. How do you ensure that you stay safe while you're out there? And what do you do as soon as you get back to the house to decontaminate?
Okay, thank you, my brother. As a mother, as a wife, and as a trader, I'm really exposed outside when I'm there, because I sell my goods at the marketplace, which most people, that is very, very, congested. But personally, I make sure that I always, on my face mask, I sanitize my hands, and I make sure that my customers that are coming to trade with me, that they are all on face masks. I always do a social distance, because where I trade directly from my car. from my car boot, I trade directly there. So I'm very, very, far from other people in the market. And I make sure people that are coming to buy from me, they are all on face masks. So immediately after I come back from the market, I normally use my restroom because in my house, the restroom is just at the entrance of the house there. So I take care of myself, I clean up, and I go into this and take my bath. I make sure that I protect myself before I even have to have any contact with my children and other things, household chores.
Thank you. Okay, I will stay with you, but I would like to ask the men in the family, I mean the fathers now, a rather morbid question. I will start with you, Mr. Ayigbe. How do you explain to the kids that someone has died from coronavirus? Has that ever happened so far? I mean, you having to explain. Mr. Ayigbe, can I get your response?
Thank you once again, Mr. Namdi. First of all, like I said earlier, COVID-19 does not discriminate wherever you are. And, as a family, to tell your kids that people die, it's actually a very serious thing. Number one, I give glory to God that neither us and our family nor the people we know have have died of this, and we don't pray, none of us will do that. But as a family, information is very vital. As family, every now and then we are always on the news to see what happens, even the number of deaths, and to make them to know that, you see, this thing is lethal. And because of that, we made them to understand that the personal hygiene is absolutely important. Like I said initially, in my first response, because of the experience, the kind of work I do, we are trained and retrained on personal hygiene, which has been inculcated. So now, making them to know that people die, and for them to be able to even know the data, know the number of people that have died and all that, but making them to know also that there's still a lot of recovery rate concerning this. So is absolutely important, so that we can, the information is passed across. Like I said, we thank God that we're still praying that nobody's going to be part of it. Thank you.
Can quickly bring that up. Okay, I understand we're having issues with their connection, but if you can hear me, we still have the. Okay, great. I understand that they are up now. Mr. Oyalowo, I would ask you the same question that I just asked Mr. Ayigbe now, and about the issue of how you have to explain that people die from coronavirus. Hey, your turn now, Mr. Oyalowo. How do you explain the rather, frightening concept to your kids that someone has died from coronavirus? Have you had to do that at any point since this whole pandemic?
Yes, sir. The awareness about coronavirus is something that is so obvious, and that virtually everybody within the city of Lagos here, one way or the other, are getting the information about the disease. And most often than not, as part of the family culture, we do watch some of the enlightenment programs that educate about the state of the diseases and the level of its impact. So on most occasions, when they are drawing up those statistics on radio programs or TV programs, most especially my eldest daughter, I've always intimated her with those statistics. But the reality of getting a very close awareness was when we lost the chief of staff to the nation, and they were showing the live burial of late Abba Kyari. So my daughter was forced to ask question, Daddy, what led to the death of this person? Who is the chief? I said, Chief of Staff is part of the President Buhari a cabinet member, and he died of coronavirus. So as part of the education and the orientation we've been doing, so she now gets to the reality that indeed this is a deadly disease that someone have to keep up to the measures and the necessary safety measures as laid down by the medical.
I'm sorry, but I have to come in here. We're fast out of time. Unfortunately, there's a lot that I wanted us to talk about, but I assure you, I will create another opportunity for us to continue this conversation. I want to thank both families. I want to thank the Ayigbes in Port Harcourt. I want to thank the Oyalawas in Lagos for sharing your experiences with us. I want to wish you the very best, both families. I would have loved to talk to the kids as well, but unfortunately, we're fast out of time. But like I did say earlier, I can assure you we'll do this again. Thank you so much for coming on Insight, both of you, both families. Up next, we raise some public health concerns with an expert. And I'll bring on Dr. Isaac Abuja, who is a public health expert. He joins me here in our Abuja studio. Welcome to Insight, Dr. Abuja.
Thank you.
Dr. Abuja, we've been getting some troubling statistics on the infection positivity rate, especially at community level. Do you think this is a function of inadequate public sensitization, or it is a fallout of blatant disregard of the guidelines laid out by the NCDC, by, of course, members of the public?
I think it's a combination of the two, largely because the pandemic has spread to the community and people are not responding to it the way they are expected to. We had expected that with the sensitization at the beginning of this pandemic, by now people would have been so convinced that they would handle issues better than they are doing at the moment. The issue of washing hands frequently, the issue of wearing masks, especially when you are outside in the public, the issue of making sure that when you cough or sneeze, you do so to your elbow or to a tissue or a handkerchief that you can dispose, and the issue of social or physical distancing from each other, those issues have not been adhered to, and it is rather unfortunate. More so because instead of people being convinced with the alarming number that we are recorded now, they are rather saying no. Some of them are saying, no, this is false. There's no such thing as COVID-19. There's no such thing as coronavirus. We have malaria. We have this. We have that. Yes, indeed, we have those things. We've been living with malaria for decades or for ages. That is true. We've also been living with other diseases. But that does not mean that new and emerging diseases don't crop up. Like right now, we have coronavirus. We never had it before. We do have now. And if you notice in the last few years, we've been having frequent epidemics of Lassa fever. We had Ebola some years back. We have hepatitis and so on and so forth. So the fact that there is an endemic or there are endemic diseases does not preclude or does not prevent the emergence of new diseases. And this is what the situation is at the moment.
I think we should quickly bring up the issue of myth and facts and how they impact on public sensitization. There are streaks of news out there that are supposed to tell facts and the truth only about the current global crisis. However, apparently not all news deliver facts, but rather they draw more attention to create a more disastrous situation than already is. Sometimes they even emerge from otherwise credible sources even within the health sector and deliver distorting news on the infection rates, for instance, on treatment, and sometimes even on the spread of the virus. How critical is information management as a component of public health?
Very critical. Very, very critical. We need to understand issues the way they arise. The issue of treatment, let me handle that one first because it's a little delicate. The issue of treatment, you recall that we have been repeatedly saying that this coronavirus is new, and that's why they say novel virus. Novel in Spanish means new. And it means that we, when I say we, everybody, all humanity, whether you are talking from China, from America, from Africa, from wherever. It is the same story. This is new to us. Most of what we are doing is trial and error in terms of treatment. Nobody has got a full handle of what is supposed to be, this is it. We have not got the this is it yet, not even in terms of treatment nor prevention. In prevention, I'm referring to vaccines, for example. Prevention in terms of what we should do by way of our conduct, by way of our behavior, by way of our reaction to the pandemic. We know what to do to prevent the infection, but we do not yet know the vaccine that will eventually emerge, that will prevent the disease. Neither do we know the definite treatment regime that should be followed. So if today you get news about this drug is working or that drug is working or something else like the ventilator, for example, at the beginning of the pandemic in America and in some other places, they thought that the ventilator was the solution to the problem. We later found that no, it wasn't, and that the use of the ventilator was for those that were very critically ill. And even for them, what we thought was the problem. In other words, we thought that it was just a mechanical problem with the lungs, in which case the ventilator will take over the role of the lungs in terms of expanding the lungs, taking in oxygen and releasing carbon dioxide. We know better than that now, that the virus does something totally and, well, if not totally, almost different from what was thought to be at the beginning.
It's quite critical how we manage information. And
yes, in terms of the numbers, it is critical for us to manage the information very well so that we can convince people of the reality of the situation at hand. However, when you have discrepancies, sometimes it is because of different situations, different environments, and it depends on who you are also talking with. If, for example, I'm talking to a fellow doctor and I explain to him the sudden surge or increase in the number of new cases, he will understand. But right now, for example, if I go to the street and I talk about it to the average Nigerian, some will understand, a lot of them will understand and will still suppress the truth and say, no, we don't believe you. We don't believe you. There are no cases of coronavirus. How could you, at this time, say there are no cases of coronavirus when daily you are listening to the television, you are listening to the radio, and you must have heard of one person or another who has been affected and who has died. We've heard of many highly placed people that have fallen sick of this disease that have actually, as a matter of fact, died, especially in the recent past. So for anybody now to say, no, coronavirus does not exist, it's just wickedness, I would say. And it is unfortunate because they are misleading themselves and others around them.
Dr. Abuja, let me quickly step in here so we can move forward quite quickly. We have seen researches in some countries indicating that nearly 40% of infections are people who do not show symptoms. Well, we do not know if that is true for us here in Nigeria. But how critical, again, is it for us to ramp up testing as a viable means of evolving a workable plan to open up other critical sectors still under lockdown, like the educational sector?
Very important, very critical. The issue of the figure of 40% of people that could
in
show,
other climes,
yes, that could show to be asymptomatic, but could be carrying the virus and could infect other people, it is possible. It is statistically possible. And even within that figure, it was also alleged that 16% of those 40%, again, might eventually come down with the symptoms, and they may not. Whatever the case is, it doesn't really matter whether it is 10%, 20%, 50%, 60%. What is important is the fact that the situation is real.
I hear you. How optimistic are you, Dr. Abuja, about the recent indigenous RNA Swift test kits recently, unveiled by the Nigerian authorities? And how is that likely to help us ramp up testing?
Very optimistic and very encouraged too. You know, many of us think that we have a lot of potentials in the country. Potentials in terms of knowledge, potentials in terms of what we could do, potentials in terms of what we can afford how we can afford to mobilize ourselves. And the fact that something like this has come up within a short, very short, relatively short time is very encouraging and commendable. And I'm encouraged because we don't need to be looking outside. We don't need to be asking other people to help us or to sell to us. Why don't we produce and sell to other people? I'm one of those Nigerians who have been for a long time advocating that we must produce all the vaccines that we need, for example, in the country. We must never aim at purchasing vaccines from other countries. We must produce our own vaccines, and we have the potential, we have the ability to do it. It is just that the will has not been there. And I think now with the coronavirus, and with the fact that even those who used to run outside the country for medical checkups, for little things that could be handled in the country, are now boxed in. They cannot go anywhere again. So we are going to die together if it is death. We are going to live together if it is life. And therefore, if they want, let them bring out the money. Let the medical experts do their job. Bring out the vaccines, bring out the drugs, bring out the test kits, bring out the supplies that we need. If they don't want to bring out the money, everybody will perish together, and I hope that it will not be the case.
We're definitely seeing some re-evaluations take place. I mean, it's one of the things that that COVID-19 has done for us. But earlier on, we talked about statistics, and let me reel out some figures for you as it affects healthcare service providers. Well, and we got these from the NCDC sometime in June, confirming that molecular lab network has increased to 30, and that 112 healthcare workers are infected in Nigeria. 29 of them work for the NCDC, actually. We also know that over 40,000 pieces of complete PPEs, that's the personal protective equipment, have been distributed nationwide by the NCDC. So far, Dr. Abuja, we hear NCDC make statements like 75% of confirmed COVID-19 infections are from unknown origin. What does that say of our public health response and our chances of winning this war?
Well, let me first respond to the first part of your question. I do not have any reason to doubt NCDC. I think they are doing a very good job. I commend them, and I agree with the figures that they put out. Let me say something. We do not have to be questioning every little thing that an authority say. If they say, for example, that the majority of cases that they have now are not traceable to any particular origin, what that means is that the epidemic has spread to the community. The infection is now within the community. At the beginning of this pandemic, what we were doing was, when people come from other countries, because most of those all those who were infected at the beginning were from outside the country. When they came, we screened them, and then we tested them. If they tested positive, we looked for contacts, people that they have contacted, people that they have interacted with. We traced them, and then we tested them. That was the mode of control at that point. Now, it is no more the case. Majority of cases are not people who are coming from other countries. Majority of cases are people who are within the country, who have not traveled anywhere. This is what NCDC means. If, for example, you go to a particular neighborhood, take, for example, Mabushi or Nyanya or Mpape or whatever part of Abuja, for example. If you go there now and test people and you ask them, have you traveled out of Abuja in the last 1 year? And they will say, no, they have not. So NCDC is right. What it means is that the transmission of this infection is going from one person to the other, person to person within the community. It's not coming from outside. It's not coming from the same type of route that it used to be at the beginning of the pandemic. That's what NCDC means. And that's what the reality is too.
That makes it clear. Well, Dr. Abuja, the authorities are still investigating some incidents that are described as mysterious death in some states in Nigeria. Hopefully we will be getting some results soon. But some would say we have a problem of surveillance. In fact, some have described it as poor surveillance, and that it could easily lead to underreporting of COVID-19 associated outcomes and deaths. As an expert in public health, give me an idea of a surveillance structure that can easily suffice in this current scenario that we have.
The best way to establish surveillance in this kind of situation is for people, members of the community, members of the public, to be well educated, to be well sensitized, and to be willing to give information, and to be willing to surrender themselves when they feel or fall ill. What we are experiencing now is the fact that people are not taking this case as seriously as they should. If they did, when somebody feels unwell and suspects that it could be malaria or it could be COVID-19, if the person reports himself promptly for testing or for treatment, we will be able to have accurate figures. Talking about figures, it is as an epidemiologist myself, I am very interested in knowing how many people are infected, how many people have recovered, how many people have died, and why they died, and where. What are the circumstances? Are there some disease conditions that have helped them to die faster, or are there some things that that has helped them to recover faster? Those are the kinds of things that we in the medical world would want to know and would want to keep in record, so that we can help those who are going to be infected later on, or who, if they become infected, will be able to help them to recover.
Let me back up a bit and return to the issue of preventives now, as infections surge in Nigeria. There are concerns that Africa may be the worst hit by the end of this pandemic, and that is because of our fragile health system. COVID-19 appears to have given us an opportunity to reevaluate and, prioritize. What kind of projections should we be making for the healthcare delivery now and post-COVID-19?
Well, two things here. Let's talk about the pandemic first. Yes, at the beginning there was projection, there was suspicion, there was belief that Africa was going to be severely ravaged and that people would be dying in numbers on the streets. Fortunately, two things have happened in our favor. First, it didn't start from here. It started from some other countries. So by the time it got to us, take Nigeria for example, by the time we had the first case in February, we had already been sensitized relatively. We were already ready. We were ready at the airport, at the seaports. We were ready to screen those who were coming in, because nobody within the country at that point had the disease. So we had that advantage of being ready before it came. Now, the other advantage that we have is the fact that though we have very poor health system, we have very little equipment to work with, we're ready, and we have been mobilized to start fighting before the fight really became a big fight. Unfortunately, what we started with is not what is happening now. At the beginning, we were very active. Everybody was panicky. Everybody was worried. Everybody was active. Unfortunately, it is more or less the health professionals now and the authorities, the government authorities, that are worried. The public seem to be relaxing, which is what is worrying some of us. We must never relax. This thing is not going to go overnight, and the earlier we fight it, the better. In terms of projection as to what we will expect, I do not believe that Africa is going to have it worse than other people.
Okay.
But that is if and only if we do what we are expected to do. Keep to the rules, wash your hands frequently, report any case of fever or any of the symptoms that might be COVID-19 related. Make sure that you observe physical distancing, and so on and so forth. If we keep this rule, and I have been mentioning something that I want to continue at every opportunity to mention. Okay. Eat well. Make sure that you have good immunity system in you. Indeed. And sleep well, rest well, eat a lot of vegetables, eat a lot of fruits, eat things that will give you vitamins. Make sure that you move around. You don't stay in one place. And if you have any disease now, chronic disease, for example, like cancer or diabetes or HIV/AIDS or hypertension, make sure that you take extra precaution, or asthma, for example, make sure that you take extra precaution and watch where you go, what you do, and obey the rules. It will help you. And if you have any symptoms that could be that of coronavirus, report as early as possible. The cases of mysterious deaths that we were talking about earlier occur. What we call mysterious is because we don't have the information. There's no such thing as a mysterious death. There's always a reason for death. If you don't know, it's the fact that you don't know. Somebody doesn't die of nothing. something is responsible. And what we are calling mysterious is the fact that we don't have the information. We should have the information. And this is one of the reasons why I want to go back again and appeal to the public. You are part of the surveillance structure that we are emphasizing on. The health staff cannot be everywhere. They cannot see every case. If we ourselves are disciplined and we can report ourselves as soon as we feel something wrong, or members of our family, members of our community, we will be able to form what we are looking for as a perfect surveillance system.
Indeed, very, very true, Dr. Abuja. We're fast losing time, so I'll just take these as your final words on the program. We do know that confirmed cases of COVID-19 has crossed the 30,000 mark and deaths the 700 mark. I suspect the death ratio should be somewhat around 0.03% of case infections. I'm not sure about that, but I do suspect it's somewhat along that ratio. It is likely to increase, like you've just said, if more people with, especially if more people with underlying ailment get infected. Are we putting into perspective, especially in our public health plan, during this period, some realities that have been with us before, prior to COVID-19, such as maternal mortality, high prevalence of HIV, you mentioned diabetes earlier, amongst others that you did mention. I guess my question is, how do we achieve that delicate balance? And this will be your final words, Dr.
Okay, two things. The first part of your question, yes, there are other endemic diseases that are prevalent that we should pay attention to. Nobody is saying that you should run away from somebody who is pregnant, or you should run away from somebody who has any of the chronic diseases that we mentioned, or somebody who has malaria for that matter. No, we're not saying people should run away from them, but we are emphasizing the fact that some of these diseases, the symptoms mimic COVID-19, and it is very difficult for health workers, especially in the rural areas, especially in the the primary healthcare settings, to know exactly what it is. So it is very important for us to pay attention to the preventive measures that we have been talking about. That is the key. So that whether it is malaria, or it is COVID-19, or something else, the precaution that we are taking will prevent us from getting more figures, from getting more susceptible to the disease and having worse statistics that we are having now. Talking about the number of people that die from the disease relative to the total number of people that are infected, this varies from place to place and from situation to situation, and it is not permanent. Therefore, I'm not going to be in the position at this time, deliberately, to tell people that the death rate is only 1% or only 2%. If you notice, it is varying from time to time. The more precaution we take, the less number of deaths we are going to record. And the less we care about it, the less we work on prevention, the more number of cases we will get.
Ensure that we don't focus just on COVID-19 at the detriment of other ailments.
Precisely. We will not focus only, and we should not focus only on COVID-19. We should pay attention to all, because death is death, irrespective of the cause.
Dr. Isaac Abuja, a public health expert, has been my guest. I want to thank you very much for your profound thoughts on all of the issues that we have talked about. And thank you so much for coming on the program.
My pleasure. Talk to you again.
Coming up next is the media review segment with Elizabeth Omoruyi.
History, the center of women in society has ensured the stability and development of nations. They are the primary caretakers of children and families in every country of the world. Studies reveal that women are key players economic-wise and political-wise. They are organizers and they change society. Women take the lead in helping the family adjust to new realities. On this segment, we will examine the role of women in nation building, and my guest, who is the president of Women Africa, Ijoma Emeribe, will define their roles. It's nice to have you in our studio.
Thank you so much.
All right, you are a leader figure when we talk about women. When you see a woman economically empowered, not depending on anyone, what do you see?
Yeah, I see a great future for both the family and the government, you know, because for a woman who is hardworking, you know, she has a lot of potentials. She has so much to give out to the society, and that will be starting from the family.
Okay.
And sometimes we talk about peace. There can be no peace if the woman is not able to train the children well. You understand? We'll talk about like during the period of, it's still there, the Boko Haram, they was okay, if you notice anything like this, just let us know. And all these people are from a family, is it not so?
Of course.
So it takes a woman who is strong to be able to groom the children, cater for the family, and still stand strong. So it's not very easy. But when you see such a woman, I think you should know that she's going far.
Okay.
Yeah.
Could you highlight the role of women in nation building and governance to us?
Yeah.
Because some women don't even know their roles.
Well, if I actually want to look at, talk about the government, you'll find out that almost 60% of whatever is coming into any country, it depends on the women.
Okay.
Because they are farming, which brings finance, you know, to the country. They take care of the children, train them well, so that tomorrow they'll become future leaders. And I think training of the a child is the most important thing anyone can think about. For instance, nowadays you hear rape here, rape there,
Yes.
especially during this period of lockdown, and you begin to wonder what is really happening. What is happening? So it's the role of the woman to really know where her girl child is, what she is doing at a particular time, where is she? And then it's also the role of the woman to tell even the husband. The woman will tell the husband, you need your face masks if you must go out.
Go out.
So these are the things that women does that gives them that uniqueness in any way they find themselves. So the women play important role in the sense that they train their children well, and they are at the front. They are at the front of maybe this medical care. That is caregivers. You know, that is one aspect that they are good at. So if you talk about all these things, you cannot take away the women. So they are the front liners.
When we talk about the rights of women, are their rights really protected?
Well, in this Buhari's government, somehow, I see that women play some very key roles. Like they are placed in position, you know, where they can actually give out what they know how to give best. And then I've always said that if you actually want to succeed in life, there must be a woman at your side, even in government. That is what it is. For instance, now, if you just say what a man cannot see, a woman can see clearly and point out and say, no, 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 let's not go this way, let's do it this way. So these are some of the things that women does, you understand, that which we really need to look into and give them their place. So I want to say that at least for this period, at least with this government now, women are actually coming up. And also they are actually coming up to say, this is what we want, give it to us, so that we'll be able to speak and also contribute to the nation building.
Okay.
Yes.
You know, gender-based violence is actually a global phenomenon. It's everywhere. People talk about it. It's happening. But really, where have we gotten it wrong?
Well, you know, every successful woman is always like a kind of in competition. The men always compete with them.
Really?
Yes, because yes.
Is it the other way around?
No, the men, you know, the men will like say, you want to show us that you can do it very well.
Okay.
And when you say that, if it's a weak woman, she will like want to say, okay, let me keep my cool.
Okay.
But you need such a woman who is intelligent, who is able to actually look at a particular thing and bring solution to that problem. Whether she is a woman or that should not be the main focus. the focus should be, what is she able to bring? What is she able to contribute to our society? But nowadays, when a woman wants to do, they will say, you want to show that you can do it. You want to prove yourself. But look at it, everything is changing. When a woman is in business, she'll be able to sustain her business, and the children will come up and also benefit from that business. But if a man, sorry to say, is the truth. Okay. When a man is in that business and is succeeding, at a time, the end story may not actually be as good as when the man started this thing. So, because the woman will always think about the future of the children, how to keep the name, the good name of that family. So all these things are things that the women do. But when they actually come, even if in the home self, if you want to contribute too much in the home,
it becomes an issue.
It becomes an issue. It will be that you are the one that wants to play the role of a father now. Those statements are statements of intimidation.
Okay.
It is not right. When a woman is doing well, that woman is only helping the family to grow. It is not like you're coming
competing.
We are said to be helpmeet. A woman who is helping you is only there because that is what we always know. Even the word of God, even Quran itself, also the Bible says that all these things are there. We learned it from somewhere. We didn't just start saying them. We didn't just start acting that way. So a woman is made for a man.
Okay.
A woman is made to help the man. But if the man does not see that good aspect of the woman, all he will be seeing is competition, which is not good. So even in the office, it's the same thing. Allow the women to play their role in the society so that where there is lapses, they'll be able to fill in those lapses, and then from there we'll go on. Yeah.
Post-COVID-19, what should be the focus for women?
Well, COVID-19 is here. We are not running away from it. Now, after all that have been said and done, the focus now should be, like we always say, when you empower a woman, you empower the whole world. You empower the family. You know, if you say you want to empower a man, let me tell you something. The men are focused on one thing. If a man wants to build a house, he wants to build that house before he will look at school fees other things. You know, but a woman, just like she sits in the kitchen and she's thinking, is the soup going to burn if I leave this place? Is the bedroom, has the bed been laid? The house, has it been swept? What is happening? The children that are gone to school, have they come back? These are all the things.
And as she's cooking, she's arranging the clothes, she's making the bed,
doing all those
she's
things.
seeing to the cooking.
Seriously, those are the things that she does. But the men, they are focused on a particular thing. That is why the woman is always there to do the other things that the man is not seeing. You understand? So right now, if we give a woman 20,000 naira, for instance, a market woman, 20,000 naira, we're talking about post-COVID-19.
Yes.
Give her 20,000 naira. Look, first and foremost, look at the business she has been doing. If she is a food seller, you know, you need to, how much did you use to start this business? You say 20,000 naira. Are you sure? If I give you 20,000 naira, what can you make out of this 20,000 naira? She'll say, okay, I'll buy yam 5,000, I'll buy tomato 2,000, she'll put all these things there and start selling. Within 1 month, the 20,000 naira she started will come. And then the children will still eat from those same things that she is selling. And then from there, she will pick up her life again. So we don't need to give them rice, no, to eat. All we need to do is to build them up, give them small money for them to start up a business, and from there, they will have their lives again.
Interesting.
So, yes. So that's it.
So what's your final word to women out there?
Well, I would say that for a lot of people, there's something I've come to, you know, when I've worked with women for the past 6 years. I started with young people, and after a while, I worked with young people for almost 10 years before I came to start with the women. I realized one thing, they have to be sincere to themselves.
Okay.
As a woman, you need to be sincere to yourself. You need to know what you want. Yeah, you need to get what you actually want. Not if anything comes, say, give it to me. This one comes, give it to me. You take everything, but you cannot account for anything. So at this point, the world is changing. It is no longer the way it used to be. People are, there are a lot of things that are happening now, so we have to be careful. We have to get closer to God this time. Because when the COVID-19 started, for me, I thought that the world has come to an end. You know, a lot of things was running through my mind. Sometimes you have the money, you cannot buy anything. So all these things, we need to play them back in our minds and we ask ourselves, if the world had come to an end, what would it have done? If this COVID-19 that we are seeing, that is everywhere and the world, other parts of the country are suffering, and then we here, especially in Nigeria, we are, you know, at least it comes and we have cure for it. Our healthcare, they are doing well in treating these people and then discharging them. If it had to hit us like it hits other countries, where you have to watch your children die, perhaps of hunger, or maybe you have the money to cook buy the food. There's no food for you to buy. You can't go out. So we need to be closer to God now more than ever. Not in insincerity, the way we used to do before. When they come to give people, when we go for, maybe we want to give people
outreaches.
Yes, we go, yeah, want to empower people, even people who have 200,000, they want to also partake of the 20,000 that we are giving to all these women that don't even have anything, a startup a plan for anything. They'll also take from that one and add to their own. So we are saying that this is not 2019. 2019 have come and gone. We're in 2020, and a lot of packages are yet to be afforded in 2020. So we need to be very, very careful. We need to be truthful to ourselves. We don't need to be deceived again. We need to stand and get focused and ask questions when we want to do anything so that we'll get the right answers.
All right, Reverend Ijoma Emeribe, thank you so much for your time. Thank you for sharing your thoughts with us.
God bless.
Thank you very much.
You're welcome.
And that's it on the Media Review segment this week.
Thank you very much for staying the course. This episode has been quite insightful as usual. Join us same time next week for another thought-provoking episode. I'm Nnamdi Odipo.
And I'm Elizabeth Omori. And let's not forget the role of women in nation building cannot be ignored. Let's support them.
My brother, my